Kids are like little rubber balls. Think of them that way. They're more compliant. So if we had a trauma, we may break bones and crack. Kids just kind of think of a racquetball, squish and come back out. So what happens is, hey, I don't see a broken arm, a broken leg, I don't see broken ribs, but inside the liver can be lacerated, the spleen, internal organs. So I think if you remember that analogy, don't get thrown off that the bones aren't broken or anything else. There can be severe internal trauma. And they trick you in other ways because if you look at the pediatric shock curve, we learn the classes of shock as a paramedic. It's bread and butter, like class 1, class 2, class 2, class 4. You get hypotensive. You first get tachycardic, then you get hypotensive, then you get altered, and those are your classes. But in kids, they'll hold their blood pressure. They'll hold it, they'll hold it, they'll hold it, they'll hold it, and then all of a sudden, it'll tank, like, and don't miss that. Like, there have been deaths in the emergency room where kids, like, they're bleeding out their diaper or somewhere, a nosebleed, and they don't even have that much blood circulating in them, a few hundred cc's if even. And that can be a significant amount of blood, and their blood pressure, everything's fine. And then all of a sudden, you're coding them. They just drop really quickly. So for the paramedic, what I want them to remember is it's going to go down fast, and you have to be ready for that. And you're not going to have those classic stepwise progression of shock into a coding patient. It's just going to happen. So remember, you may not see a broken bone. They're like rubber balls, and just be ready for it. It's better to think ahead. So the art of being a paramedic is knowing what you know and what you need to do, but also sometimes knowing the next step beyond that, because you can help prepare us for that next step. Start those IVs, get that airway secured, so we're rocking and rolling and ready when they come in. Like, we really count on you guys.